Good morning, ma'am. My name is Rap Pineda, and today I'll perform the Immidiate newborn care. So first thing we have to do is to prepare the room temperature of the delivery room. So room temperature should be 25 to 28 degrees Celsius. So after that is to prepare all equipment. So as you can see, I prepared all equipment that I needed. So next is to check the resuscitation equipment. And then for the nursing diagnosis, the risk for body temperature alteration is related to inability to shiver, change in environment from intrauterine to extrauterine, and limited amount of insulation. And then from the outcome, infant will remain free of complications that participate hypothermia and cold throughout the stay in the hospital. So for the intervention is we need to wear face mask and bonnet properly. Then assume that I wear a bonnet, and then after that is wash hands with clean water and soap. So I already washed my hands, and then wear gloves. So then is to don't double glove just before the delivery. So within first 30 seconds, we need to dry the newborn. We need to dry the newborn thoroughly for at least 30 seconds. So next is to do a quick check of breathing while drying. Do not suction unless the mouth or nose are blocked with secretion or other materials. Then wipe the eyes, the face, the head, the front and the back, and also the arms and legs. And then after that is remove the wet cloth. So after 30 seconds, if newborn is breathing and crying, so position the newborn prone on the mother's abdomen or chest. So assume that this is the mother. So after that is cover the newborn with cover the newborn's back with a dry blanket. Then after 30 seconds, next is to cover the newborn's head with a bonnet or cap. And then after 1 to 3 minutes, properly time to cord clamping. So remove the first set of gloves. So assume that I remove the first set of gloves. So next is after the umbilical pulsations have stopped, so clamp the cord using a sterile plastic clamp at 2 cm from the base. And then do not milk the cord towards the baby. So next is to clamp again at 5 cm using forceps from the base. And then after that is place the is to cut the cord to the plastic clamp. And then after that is to place the identification band on ankle, not wrist of corresponding gender. So after that is leave the newborn in skin to skin contact. So after that is to observe for feeding cries, including tonguing, licking, or rooting. So point this out to the mother and encourage her to raj. So after 50 minutes, remove the newborn from mother's abdomen. And then transfer the newborn to the work table, and then weight the newborn to the work table. So assume that this is the weight scale. Okay. So after that is to perform physical assessment of the newborn and do Apgar scoring. So after that is perform anthropometric measurement. So for the measure the head with the measuring tape. And then the chest circumference. Then right. Then the body length from head to toe. And then right. And then take the rectal temperature using the temperature. So put the baby on other hand, and then put the temperature on her here. So after you get the rectal temperature of the baby, next is we need to inject the vitamin K vastus lateralis. And then after that is to apply the eye prophylaxis. Then after that is put on the baby's clothes. And then wrap the baby with the baby's blanket. So obtain heart rate and respiratory rate, and then show the baby to the mothers. Latch on the baby to the mother's breast. Ayan. So after that is the evaluation. For the evaluation is document the following: the anthropometric measurement, the Apgar score, the medication given, and lastly the footprints.